afternoon, everybody. I think I'll try to keep this under 10 minutes. I know we're running way behind. I had the fortunate experience of working with Palm Beach ACO as their CEO for 2.5 years, and now I'm traveling around the country at the bequest of Medicare and the Brookings Institute and Dr. Farzad Mastashari, because I really believe that we can make a difference. And my innovation, and I'm going to go through my slides from that I just came back from DC, my innovation that I want to talk to you about today, it's not the ACO, it's about belief. It's about believing that we can make a difference. We started this 2.5 years ago, Palm Beach ACO did. This is a very visionary community with the Palm Beach County Medical Society thinking about the future of medicine for the last 7 years. So everybody asked me, why did Palm Beach ACO make so much money? Not a clear answer, but I got to tell you the biggest part of it was they believed they can make a difference. So they came together and they worked together and they made a difference. So I'm gonna go through just a couple slides from Washington just to let you know that whether you're in an ACO or you're not in an ACO, all this information is out there and it is coming, and Medicare has changed. It's the biggest purchaser of services, so we can expect the same from everybody else. So the first thing, one of the thoughts coming out of DC is they're afraid that a lot of people will abandon this program because not many did. As Rick just told us, only 1 out of 6 made money. So there is a risk of abandoning it. The program has a lot of flaws. Now they're about to introduce the rulemaking for the second 3-year period, but here's just a few of the flaws that it has. Beneficiary churn. As an ACO, you don't know who your beneficiaries are. You're given a prospective list, mostly because you need to notify those patients. But the idea is you need to keep those patients in your office. You need to, for lack of a better word, you need to build that trust with the patient against that they come back so that you can keep track of what's going on with them. So it's a big problem because the doctors don't know who their patients are. The transparency that Medicare's given us, the claims data is very seemingly inaccurate. It's very difficult to follow. It takes a very long time to get it, at least 9 months. So you want to probably take a more proactive approach, and that's what we did in Palm Beach. Proposed rule is not ready for already. The next 3-year period's coming out in 2016. They have not introduced the new proposed rule. So it's very difficult for people to make a decision whether they want to do another round of ACOs. The risk scores, they don't provide the risk scores by patient, which is a problem for ACOs. They're starting to see that the ACOs may turn into Medicare Advantage because the rules are more clear, and the MSSP, Medicare Shared Savings Program rules, they're a moving target basically. And also the national mean. Dr. Zucker and I are traveling around the country now. We just met an ACO who had $600 per member per month, and this group of doctors still felt like that they can reduce some waste and have some success. And then we're also looking for Medicare to give us points or quality measures for continuous improvement on ourselves, not over the nation. But if you have a group of doctors that are improving on themselves, we're looking for that. I only put this slide in here because none of this is new. Senator Grassley said this in 2005, and basically it's just saying that the Medicare is not paying for outcomes, they're just paying. The current thinking from large purchasers other than Medicare, like the plans, Cigna, Aetna, Blue Cross, all have ACO-like products, but the bottom line is that they're trying to get everybody transitioned into a global payment to take risk. So I've heard the saying these are training wheels for taking risk, but it definitely has opened everybody's eyes about outcome-based processes. I think this is interesting. We've heard about this morning about consumerism. If you look at just the red block, it basically says by 2014, 43% of the patients are picking a Medicare Advantage plan that has 4 stars or more. And you can see back in 2009, only 16%. So the public is aware. There's a lot of transparency. As we know, that the New York Times had a full disclosure of how much everybody was being paid for Medicare. So the public is very aware, and they're going to start to become more aware as time goes on. Value-based purchasing, the one thing I'd like to concentrate, since this is a room full of physicians, is the value-based payment modifier. Not a lot of people know that it's coming. Some do, but some don't. But basically, It is the grading system for doctors. And Dr. Zucker says to our doctors at Palm Beach, and as we travel, if the doctors knew what the grading system looked like, they would do very well. So this stuff is all written, and it really is already out there, so it's not new. So the value-based payment modifier for physicians will be fully implemented by 2017, and groups of 100 or more are already in that program right now. And the value-based payment system is based on two things, cost and quality. So there literally is a 3 or 6% swing on cost and quality. If you're a doctor that falls in the higher category, it says 2%, but there's an additional 1% at the bottom. You would get low cost, high quality, an extra 3% on your Medicare fee for service. If you fall in the bottom category, you could get a 3% reductions. And they're going to make those reductions higher. This is just them easing everybody into the program. The thing I like about this is the value-based modifier. Here are all the domains that come into the quality, and here are all the domains that come into the cost. But ACOs are absolutely giving everybody a head start on what those domains are and how they can work with them. And it is, I just heard Dr. I forget his name, talk about the happiness of the physicians. Dr. Tootie. Absolutely everything he said is true. The happier the physician, the better everything goes. So the physicians, as they're doing this, are starting to find that the processes are falling into place for them. And the last thing I wanted to show you is that these are all the programs that Medicare has out there that are coming. If you don't know about them, they are there. So the one I want to concentrate on with the Palm Beach County Medical Society is the state